Welcome to another episode of the News Roundup. On today's show, we're going to be discussing Australia, where the government there quietly noted in budget papers that they are adding children under 4 years old to Australia's vaccine injury compensation claims scheme. And yet, as of now, no vaccines have been approved for children under the age of 5 in Australia. So what is going on here? Well, we're going to discuss this. And so from Trial Site News, I am Adrian, and our episode starts now. So, while no coronavirus vaccines, as of now, have yet been approved for children under the age of 5 in Australia, Australia's Vaccine Injury Compensation Claims Scheme expanded to children under the age of 4, as health agencies in the country, down under, are appearing to prepare for COVID-19 mass vaccination of babies. Greg Hunt, the nation's health minister, went on the record that although children under 5 years are not yet authorized to access the COVID-19 vaccines, they most certainly will be in the future. Consequently, the forthcoming budget includes liability monies for children aged 0 to 4. Fred Chung, recently in an article posted on news.com, reported on this developing situation, saying that children aged under 4 years old will be added to Australia's Vaccine Injury Compensation Claims Scheme, as health authorities lay the groundwork for administering COVID-19 jabs to babies and toddlers. While no coronavirus vaccines have yet been approved for children under 5 in Australia, Health Minister Greg Hunt revealed as part of Tuesday night's federal budget that planning was underway for children aged 0 to 4. The government is investing more than $1 billion over 2 years to ensure continued access to safe and effective vaccines for all eligible people. Now, in the article, Fred Chung also mentioned that the Health Ministry press release said that there would be an additional $200,000 set aside to, and I quote, enable cardiac MRI for myocarditis to continue for a further 6 months. The government announced last year that a new item was temporarily being added to the Medicare benefit schedule for cardiac magnetic resonance imaging to diagnose myocarditis after COVID-19 vaccination. Myocarditis and pericarditis, which is an inflammation of the heart muscle and inflammation of the lining around the heart, is a known but rare side effect associated with Pfizer and Moderna mRNA vaccines. This according to the CDC and the WHO. Now, this is worth noting as the World Health Organization's Global Advisory Committee on Vaccine Safety, or GACVS, COVID-19 subcommittee, spoke about this issue themselves last year in July of 2021, saying that while the benefits of the mRNA COVID-19 vaccines outweigh the risks in reducing hospitalizations and deaths due to COVID-19 infections, vaccinated individuals should be instructed to seek immediate medical attention if they develop symptoms indicative of myocarditis or pericarditis, such as new onset and persisting chest pain, shortness of breath, or palpitations following vaccination. Clinicians should be aware of the risk of myocarditis and pericarditis with mRNA vaccines and those most likely to be affected. They should be alert to presentations such as acute chest pain, shortness of breath, palpitations, and palpitations that may be suggestive of myocarditis after vaccination, especially in adolescent or young males. Coronary events are less likely to be the source of such symptoms among younger people. And so it would seem that the Australian Health Ministry is taking steps to address this potential risk by adding measures to monitor for this potentially serious side effect. Now, while all of this is going on, 95% of the Australian population has already received at least 1 dose of the SARS-CoV-2 vaccine. Over 82.5% are fully vaccinated, and over half the population boosted with a 3rd dose. And yet, cases have skyrocketed over the past few months. The population represents one of the most heavily vaccinated worldwide, much like New Zealand, South Korea, and many other nations. This doesn't seem to matter with SARS-CoV-2 infections. With almost 83% of the entire population immunized and over 50% boosted, cases now surge. This is concerning as, for much of the pandemic, Australia has followed, somewhat loosely, the Chinese authoritarian model of enforcing a zero-tolerance COVID policy from the start of the pandemic. The country's health authorities, in combination with other government agencies, made chilling moves to crack down on the population who might not go along with the plan, even going so far as to set up quarantine camps, a move that was sure to instill fear into the hearts of its citizens. And yet, in the beginning, this seemed to be working as few cases were ever reported as the country, already an isolated continent, was hermetically sealed off from the rest of the world. That is, until the Delta surge began during the summer of 2021. Cases were on the rise and continued to accelerate by the end of 2021, with the entry of the Omicron variant, leading to more and more cases, hospitalizations, and deaths, which started hitting record numbers by December 2021. All of this despite the population's heavily vaccinated status. Now this is important because the heavily vaccinated population was to be protected against deaths. Yet, much like in the cases of South Korea and New Zealand, there was a record surge of deaths accompanying the Omicron surge, as the pathogen can more easily evade vaccine-induced antibodies. Now the thought is that perhaps the boost dose will slow the surge of death down, but the deaths already occurring are among a heavily vaccinated population. The same trend can be seen with hospitalizations. By December 1st of 2021, 73.4% of the population was vaccinated, and by February 1st, nearly 80% of the population was fully vaccinated, and nearly a third of the Australian population had received a booster program, or third dose. And yet, the hospitalizations hit record numbers and are now on their way up, despite over half the population being boosted. So the question then is the vaccination plan working? While reviews of state-level data in the past that we here at Trial Site News have covered revealed that the death rates of the unvaccinated are significantly higher, but one could ask the question of why these large outbreaks of COVID-19 cases are accompanied by increases in hospitalizations and deaths despite such a heavily vaccinated population. Well, as Health Minister Hunt declared alongside Care Minister Richard Colbeck, Regional Health Minister David Gillespie, and Mental Health Minister David Coleman, he said that vaccination against COVID-19 remains the most effective way to prevent severe disease, hospitalization, and death. Health Minister Hunt also shared recently that over 95% of the population aged 16 and above have received at least one dose of the vaccine. However, as children haven't been vaccinated yet, and given that Hunt just said that vaccination against COVID-19 remains the most effective way to prevent severe disease, hospitalization, and death, could they be targeting children, thinking still that they serve as vectors? It's certainly a question worth pondering. And that, my friends, brings our episode to a close once more. As always, thank you so much for joining me on the program today. From Trial Site News, I am Adrian, and I will see you all next time.